Hi, everyone. My name is Hriday Bhambhvani. I'm one of the urology residents at Weill Cornell Medicine and New York Presbyterian Hospital. First of all, thank you for the opportunity to share our work exploring the relationship between low-dose finasteride and sexual dysfunction. Finasteride is one of the most commonly prescribed treatments for male pattern hair loss. Millions of men take it, including many young men in their 20s and 30s. It works by blocking the conversion of testosterone to dihydrotestosterone. Data from clinical trials suggest that there's a small but significant increase in the risk of sexual dysfunction in men taking low-dose finasteride. However, real-world data has been inconclusive. To address this, we used a large national database of electronic health records from over 150 million patients across the United States. We identified nearly 6,000 men between the ages of 18 and 50 who were prescribed 1 milligram of finasteride for hair loss, and we carefully matched them to nearly 6,000 similar men who were not on finasteride. The groups were matched on age, body weight, race, and medical conditions known to affect sexual health, like diabetes, high blood pressure, depression, and anxiety. In the short term, at 6 months, we found no meaningful difference in erectile dysfunction rates between the groups. But as we looked further out, a significant gap emerged. At 3 years, men on finasteride had a meaningfully higher rate of erectile dysfunction, about 4% compared to roughly 2.8% in the control group. That corresponds to about a 46% higher relative risk. We also found significantly higher rates of low libido and ejaculatory dysfunction at the 3-year mark in the finasteride group. Now, to put this in perspective, the absolute difference in ED at 3 years was about 1.3%. That means approximately 1 in 79 men on finasteride will develop ED as a result of the medication. These results were consistent across multiple sensitivity analyses, including when we compared finasteride users to men taking oral minoxidil instead. Now, while these findings are statistically significant, it's important to keep the absolute risk in perspective. The difference in ED between the two groups at 3 years was about 1.3%. Finasteride remains an effective, FDA-approved treatment, and for many men, the benefit to their hair and to their confidence will outweigh that risk. Ultimately, the core message here is shared decision-making. Providers should be having this conversation up front, laying out the real but modest risks, discussing alternatives, and letting the patient weigh in. It's also worth noting that our study was not designed to assess whether these side effects persist after stopping finasteride. That remains an important question for future research. So, in conclusion, hair loss is something that affects the confidence and quality of life of millions of men, and they deserve treatments that are both effective and safe. Our hope is that this research helps patients and their doctors have a more complete, evidence-based conversation about finasteride. Thank you.